We now move to a specific form of therapy. This is a presentation on optimizing proton therapy. We'll get an introduction to what it is and how it can be used, with evidence on the economics and around its application and impact. So I'd like to welcome here remotely to present to us Stephanie Bol, Head of Department at Centro de Proton Terapia, Quiron Salud. So over to you, Stephanie, and for the presentation. You can hear us and we can hear you, I hope.
Hello, thank you for the kind invitation. So the topic of my presentation will be the cost effectiveness of proton therapy. Around 50% of the patients treated for cancer receive radiation therapy as part of the treatment. Photon-based treatment are the most widely used technique of proton therapy, of radiation therapy. Proton relative to photons spare healthy tissue by depositing minimal energy before and after the tumors. The theoretical advantages of proton therapy lies in the ability to minimize the radiation dose to the healthy tissue. Proton therapy may improve survival of morbidity or reduce risk of secondary cancer related to radiotherapy. Next slide. Literature suggests superiority of proton therapy over photon therapy, mainly in terms of side effect. More than 100 clinical trials are currently ongoing. Recognized indication of proton therapy are variable according country. Core indication of pediatric patients, eye, skull base, and paraspinal tumors. Recent data suggest a benefit in brain tumors and head and neck carcinoma. Reduction of toxicity would result in a better quality of life in long-term survival. And here is the update indication of proton therapy in Spain. I cover all this kind of indication who are well recognized around the world. Next slide. The development of proton therapy began in the 50s and expanded in the last 20 years to hospital-based facilities. There are now 116 facilities worldwide providing proton therapy versus more than 150,000 linear accelerators for proton-based therapy. Proton therapy thus currently accounts for fewer than 1% of all radiation treatment delivered. But proton therapy is an expensive technology. Construction costs range from $25 million US dollars up to $20 million dollars, depending on the size and the capacity of the facility. The investment and the running cost of proton therapy increase the treatment cost up to 3 times in comparison with conventional radiation therapy. Regarding the low evidence of increased activity over lower cost photon-based treatment, it's another barrier to the development of proton therapy. Different strategies are proposed to reduce the cost and increase the access to proton therapy. With the development of a compact system, proton therapy become more affordable. A single-room facility could be integrated in existing hospital. Next slide, please. For example, a report for Canada showed that the cost of sending patients abroad for treatment are greater than those associated with operating a single-vault proton therapy facility in an existing radiation oncology facility in Canada. Over a sufficient long-term horizon of around 10 years, constructing a single-vault proton therapy system in Canada will save cost, but constructing a multi-vault system will not. Next slide. Another way to optimize the use of proton therapy is to use hypofractionation. Hypofractionation is a radiation oncology concept in which larger doses per fraction are administered, therefore less fraction as prescribed as in a given treatment course. This concept has been increasingly utilized in the recent year in the external beam radiation therapy with the improvement of the technique. Hypofractionation has the potential benefit to reduce the length of the treatment and treatment cost, in which result to potentially increase the number of patients who have access to proton therapy. Next slide. On the other side, increasing healthcare expenditures have been observed worldwide in the past few decades. On the healthcare expense, the cost relative to cancer treatment account for a major portion with government intention to constrain the expenditures. In Europe, direct costs of cancer have almost doubled in the last 30 years, but at the other hand, the total productivity loss has been decreased despite increasing incidence of cancer. This reduction results for a decline in number of the cancer deaths in working age patients and a shift of deaths toward older age due to increase of survival. Next slide. Mounting pressure on the healthcare budget encourages a focus to the efficiency and sustainability of a system. On the other hand, clinicians argue that the cost of proton therapy should not be used as an excuse to limit its access regarding the benefit for the patients. To conciliate both sides, we have to apply three ethical principles. First, the benefit of treatment must outweigh the risk. It's the role of the physician to evaluate this point. The autonomy of the patient needs to be respected regarding the choice of the patient regarding the type of treatment, but we need also to pay attention to the fairness, to the justice from the point of view of the society. The role of healthcare economic is not to spend less, but to invest better, to provide the highest possible level of well-being from the available resources. And this is an ethical goal because this is ethical to be efficient, to be the best possible employer. These concepts are used in cost effectiveness analysis. Next slide. Regarding the cost effectiveness analysis, we have to take account to the evaluation these things. First, the quality. This is the quality adjusted life year. It's a measurement to evaluate the effectiveness of an intervention. Second, with the incremental cost effectiveness ratio called ICER, with a measurement used in cost effectiveness analysis to compare the cost and benefit of different healthcare intervention, in the present case about proton therapy versus photon-based treatment. It represents the additional cost per unit of quality gained by choosing one or other technique. The ICER must be compared to the willingness to pay from the society to access cost effectiveness. Usually, the willingness to pay is around 30,000 euros in Europe, up to 80 according to countries. Next slide. The review of cost effectiveness analysis confirmed the benefit of proton therapy in pediatric patients thanks to the reduction of long-term side effects and a high rate of curability in pediatric cancer, especially in brain tumors. Regarding prostate cancer, most of cost analysis benefit fail to show and surgery. This is the cause of bankruptcy of numerous proton therapy centers in US. Next slide. Next slide, please. Next. Thank you. On the opposite, cost-benefit analysis for breast cancer show a potential benefit for a subpopulation of patients who are at risk to develop secondary cancer and cardiac toxicities. Based on this cost-effectiveness analysis, now, recent clinical trial includes this process in the design of the trials. For example, in this trial regarding breast cancer, the main aim of the study will be the reduction of toxicities, taking account the amelioration of the improvement of the health quality of life of the patients. This study will be certified according different parameters as age of the patient, cardiovascular risk pre-existing cardiovascular risk, but also the proximity of the cancer and the heart, for example, in case of mastectomy or in case of partial resection of the breast or in case of left side cancer. In next slide, please. In Netherlands, the treatment choice between photons and protons is not based on a randomized trial, but it's based on a planned comparison with included based on the probability for a patient to get toxicity related to the dose delivered to different organs at risk. The next step will be to integrate the concept on cost effectiveness in the choice of the best treatment for the patient. In the case of head and neck cancer, for example, the choice of proton therapy could be done not only based on the risk of dysphagia or hypothalamic or dysphagia, for example, but need to be included also other parameters like the patient age or the positivity of HPV inside the tumors, because previous analysis of cost effectiveness showed that the patient who benefit most of this type of treatment, advanced technique of radiation therapy, are the patients who are young with HPV positive tumors. So in conclusion, between photons and protons, the perspective is an agreement with a proton therapeutic window that will evolve in the time and still need to be optimized. In my conclusion are that protons are a promising tool, but not a magic bullet. It's the responsibility of all stakeholders to define what are the indications of proton therapy to treat rare cases like pediatric cancer in expert centers, and to implement different approaches to reduce the cost of treatment and to develop new trials, for example, to improve the selection of the patient in terms of cost effectiveness, not only at the level of the patient, but also at the level of the society. Thank you.